Hello everyone, this is Raul Pinto and we are welcoming you to a new episode of Small Talk when we talk about healthcare issues with different experts in different topics. Today we are honored to be here with Claudette Holloway. As she told me before, she's been a nurse for many years. She's also been in the past RNAO president for chapters or region number 6 and 7, region number 7, and she has the time to be here and to talk to us about different issues that we want to address today. Unfortunately, there's many things that we need to talk about that are not so happy for everyone. In Ontario, Bill 124, we're still struggling with the pandemic, and nurses have been experiencing different verbal and physical abuse in hospitals, and not only by patients, but also by co-workers and by patients' family, or sometimes even by their superiors. But before that, we're gonna welcome Claudette. Claudette, how you doing? Thank you so much for your time today.
Thank you. Good to be here.
Claudette, well, as you told me before, you worked as a nurse for many years. Can you please tell us a little bit about you? How did you decide to become a nurse, and how was your experience during all these years?
Yes, well, way back when I lived in England, because I was born in Barbados and then grew up in England with my parents. And as I grew older, I wanted to help others. And because I saw this example in my mother with helping other people calling on her when they weren't feeling well. And I used to join in and help her with different things. And therefore I decided to apply to be a nurse in England. So I actually had my first graduation as a registered nurse in England, and then went on to do midwifery. So delivered many babies, and then came here to Canada and worked in a number of different settings. Being new to the country, one has to utilize one's skills as best as possible. So I worked in long-term care, and most recently I worked in community, and then most recently I retired from Toronto Public Health on a full-time basis, and now I work as the inaugural executive director of a small community agency.
And how did you become involved with RNAO?
Well, I had always known about RNAO from my work days in a place called Brantford, Ontario, and I worked in a long-term care home. And I thought this was I was still getting used to Canada, but I thought this was good to have a professional association. So I joined in. And then over the years, you become more interested, and you realize that, you can make a contribution to some of the decision making by partnering with RNAO and being involved. It also helps you to grow, and and then I just got more and more involved until I became a board member. I believe it was in 2013. So thanks to Rhonda Seaman Carlson, people like Joan Lesman that said to me, yes, you can really make a difference with RNAO, and it can help you to grow professionally too.
When do you think that your call to be part of this public service part of your job started? Many people just want to go and do their job and go home. And when did you decide to, as a nurse, you wanted to be part and do something else for the community beyond the great job that you were already doing?
I've always been community minded, and I think that stems again from the example of my mother, being involved with the community. But I think most nurses, they don't just do the job and go home. Most nurses, if not all, in addition to the hours that they're paid for, they're invested in a lot of volunteer hours. And I just felt that, there was something that I could do. And it's something that you kind of get involved in. You don't look at the clock. And then you realize that there's more that can be done for nursing than at the bedside or in the community. There's also the policy side where we can interact with the decision makers. And as I came along in RNA over the years, I realized that is really important. And that was an example also set for me by Dr. Sheila Basra, who was the medical officer in East York years ago, when she said, we wanted to get the smoking bylaw on the way. And, we had our committees internally in public health. And she said, well, we need to go down to the legislature. And that was my first example of going to the legislature with a group, the committee that we worked on with Dr. Basra, and presenting our information to the legislature, that committee. And then I suddenly realized that we can be very passionate, but in addition to passion, we've got to have some evidence. And Dr. Basra showed us the example where you put down the evidence so that the politicians cannot argue, they've got to respond. So I really started to build on that from my involvement with RNAO.
How was your first experiences seeing how this work directly calling on politicians to do something worked? How was your first experiences?
I think my closest involvement with the politicians was at the RNAO Queen's Park Day, when we went with the team, and I went with Rhonda Seidman Carlson, who was the lead, and I could see how the interactions go. So we were, before we go to these sessions, RNAO provides an orientation, but I could see how politicians, they want to direct the conversation where they want to go. So I learned very quickly that you listen to them, but you also do not lose track of what you want to bring to them. So, making them understand that the information that we're bringing is examples from the community, examples that are coming from their constituents, and that they have the power to make a difference. So it's trying to always steer the conversation to benefit nursing and benefit healthcare.
Perfect. Well, RNAO has this wonderful initiative called Black Nurses Task Force, which is an interesting group that look to address issues that Black nurses face today. Can you tell us a little bit about that?
Yes, I am a member of that task force, and I was very pleased to be nominated to the process to be on that committee. And we do really need to address anti-Black racism and all forms of racism against Indigenous peoples, Asian people, racialized population. As you said earlier, in addition to all the work that nurses are doing and all the challenges that they have, there is discrimination, which can be very hurtful, whether it's in the workplace or in the study place. And we know, we've heard the examples and how this impacts nurses on a mental health capacity, but they continue to work and do what they can. But we really need to bring this systemic problem to the forefront, and we really need all the supports we can to let it be known. We're not here to make anyone feel guilty. If people feel uncomfortable, that's understandable. We can work through that. But the reality is what it is. There is discrimination in nursing. There is racism in nursing, and we've got to work together. And my motto going forward is, let's work together. We need allies on board, but we must address that there is a lot of hurt that has been done.
So you were mentioning that you started early in England. You work as a nurse, and England, as well as Canada, has a decent health system. Of course, it needs still a lot of improvement, but it's recognized as a good health care system, starting with the fact that both countries have a universal healthcare system. So in spite of that, what do you see in Canadian system, especially regarding nurses, that is still need to be addressed in general?
The first thing is that the healthcare system is not free. This is paid for by taxpayers. But the politicians, at RNAO, we're trying to get them to understand that health is very important, and we need more funding. We need to support healthcare programs. We need to, for example, we need to repeal Bill-124 so that nurses can be compensated fairly to keep up with the cost of living. So it's definitely within the power of politicians. And, we spend a lot of money on defense and so on. We're not arguing about those things, but we're saying, healthcare. And if you spend dollars now, it's going to save money down the road. We need to be upstream. I worked in public health for many years, and we talk about not waiting until people are in chronic care. We want to have programs where we can help people improve their own health, educate them, So this is important.
Perfect. So let's talk about Bill 124 then. We were just talking about how Black nurses and nurses of color, let's say it, face all the time problems, as I said, with patients, with co-workers, even with superiors. Um, as Morgan Hofford, RNAO's president, told us last week in this same space, she said this bill caps nurses' abilities to collective bargain for increased wages. What do you think about RNAO's campaign asking Ontario's government to repeal this bill?
I think it's a very relevant campaign. RNAO has the power. We're 46,000 nurses strong, and we need to have more. We want to get more members. We can participate with the action alerts because this is very important, and we've got to bring it to the attention of the politicians. So we've got to repeatedly, we don't feel like we want to be nagging, but it is important because we need to speak out for those who are not in a position to speak out to them for themselves. We have nurses in ICU who are burnt out. We have nurses in the general area in public health, healthcare workers. They need to have a fair compensation to at least keep up with the cost of living. So it's not something that you can keep putting back we know that since COVID-19 that prices, we can go in the grocery store, we can see prices going up and up. So how, we need people to be respected. We know that nurses and healthcare workers, and we don't want to be called heroes if you're not treating us like heroes. We are doing our job, what we expect. We're not asking for something in excess. We're talking about fair compensation for nurses.
So in your experience working in this and fighting and speaking up, how do you manage not to get exhausted with all this? How do you manage to, because we see, right, usually they say here, if you're not male and white, heterosexual, then you are not living in privilege, and you're being, people usually go down, right, in this kind of a scale, this horrible scale that people have of privilege in the world. But then how do you keep fighting after all this time when sometimes it looks like things are not done as we would want it to be? What is your secret to keep on doing it?
Well, as you said, I think we want a better world, and therefore we cannot do it alone. I think when we have an organization like RNAO, you are not alone. I know that we have a fantastic staff within RNAO who can prepare all our documents, provide us with the evidence. So when you're working together, it makes a significant difference. And we know that in the past, we have made progress with politicians. We know that it can be done. So therefore, it continues. And we know that we have a world of the unborn. We have the world of children that are coming along who need. So it's just something within nurses that whether they're in front of a formal platform such as RNAO, but even at the bedside, people are advocating for the best in healthcare, always advocating, because that's what we want. And so often nurses are doing it, those countless hours when nobody knows that they've done so many hours, being there in the moment when family can't be there, being the stand-in for the family, in those darkest hours in the night when there's nobody there. Like it's just that human quality that nurses have and healthcare workers have, that we want to do more. We want to, because it involves all of us. This is not, we can be clients, we can be patients too. And what I want for myself has to be what I want for everyone else, the best together.
We are invited people to renovate or join RNAO as members. Also, we have to, I want to remind the students can become members of RNAO for free until the end of the month. Then the importance of being part, of actively being part, not just be a sympathizer, right? And to join and to be a member of RNAO. What do you think it's important to do so?
Absolutely important. I joined RNA years ago because I felt it was the right thing to do, to be a part of one's professional association. But as the years have gone by, I realized it was the best thing to do. So it is so important. that we come together. We have tremendous power. We can have even more power. My goal going forward is that if each one brings one, I'm looking that we could have close to 100,000 members by our 100th anniversary. But there's so many benefits to being a part of RNAO. You can join in your collective voice. You can find your voice. I found my voice. I know many others that I've invited to join RNAO, and they have said over the time they have really found their voice, so that you don't feel like you're out there on your own, that you can speak forward and that you can build up. There's professional development, there's webinars, there's the insurance piece. And even though we can't meet in person, what a tremendous job RNAO staff has done with our Zooms and reaching out, so that the education can still go on, the collaborations can still go on. There's chapters, there's regions, everyone is doing their piece to pull together so that we can consolidate our strength to support healthcare and nursing.